Learning skills and practice. This lesson uses multiple instructional methods, including a video demonstration, an instructor-guided practice, and a practice while you watch skill segment. The visual aid notation advises the instructor to either use the video or the course presentation. First, the participants watch a video providing model demonstration of the skill. Next, the instructor uses guided practice to lead participants through each step of the skill as indicated in the skills assessment tool. The participants then practice while you watch during the next video segment, and the instructor circulate the room providing feedback and correcting any errors. Follow the instructor's manual for a demonstration of skills guideline. Successful class completion is based on competency in the required skills to meet the critical objectives. Instructors teach to the standard and test to the objectives. They allow accommodations for participants who are unable to perform the skills in the traditional way but are able to meet the skills objectives. An example would be a participant with a shoulder injury who may not be able to meet the standard of keeping arms straight, but can meet the objective of compressing the chest at least 2 inches. A skills chart and a skills assessment tool are included for all required skills. The skills chart outlines how each step of the skill is performed in sequence. The skills assessment tool outlines the objectives and provides the criteria for evaluating proficiency in each skill. Because the skills are the focus in most American Red Cross courses, running an effective skill session is a priority. Focus on the critical performance steps as described in the skills chart and the skills assessment tool. Competency in all required skills must be achieved in order for a student to receive certification. Instructors should supervise participants while they are practicing course skills and provide appropriate, timely, positive, and corrective feedback. Additional information on teaching and evaluating skills is located in Chapter 5 of the Instructor's Manual. Skills are modeled for participants in the video segments and by instructor demonstrations. The First Aid CPR AED program will include sections where the instructor will coach skills and sections where the instructor will physically demonstrate skills. The Basic Life Support course requires instructors to demonstrate all skills. The First Aid CPR AED course includes demonstrations of glove removal, the recovery position, controlling bleeding, and using the auto epinephrine injector. The steps in the instructor manual are followed when demonstrating skills. Steps can be found in the instructor's notes, teaching outlines, and the skills assessment tools. The Americans with Disabilities Act provides the guiding principles related to addressing the needs of people with disabilities enrolled in health and safety classes. A resource guide for the Americans with Disabilities Act is available on Instructor's Corner under Additional Teaching Resources. Instructors should assess learners' performance to ensure competency in the skills. In particular, instructors are responsible for checking to see that the learning is occurring and participants are meeting course objectives. They're responsible for clearly identifying the critical elements of a motor skill, such as sequence, timing, duration, and technique. Instructors should focus on the critical objective of a skill as identified in each course's instructor's manual, rather than focusing on perfecting every part of the skill. Participants may need to modify non-critical steps of the skill to meet the objective. Oftentimes, changing the technique of performing the skill will allow the participant to meet the objective. Modifications for student A may differ from the accommodations for student B, even if their needs appear to be identical. The best way to determine how to modify a skill is to ask the student what will work best.